Welcome, everybody, to another Diabetes Canada webinar for healthcare providers. I'm very excited today. We have the first of a three-part series in diabetes and skin conditions or wound care as part of a larger series. I'm very excited to welcome Lisa Max, who's a clinical nurse specialist out of Vancouver and has worked in diabetes for more than 20 years. So today's topic is on diabetes and skin problems, the relationship between people living with diabetes and skin conditions. So without further ado, I'll pass it over to you, Lisa.
Thanks. Thanks for having me. I just want to start this off to acknowledge these beautiful lands that I get to live, work, and play on. I'm speaking to you today from the Tsawwassen First Nations in BC, and I thank them for the stewardship of these lands over these years. So this is the first of three modules about diabetes and skin problems. So we're going to talk about the relationship between people living with diabetes and skin conditions. So we do have some skin conditions that are quite common in diabetes, and those include fungal infections, bacterial infections, and dry skin. So with fungal infections, it's more common in people with diabetes because of the high blood glucose levels, because that leads to the weakened immune system and an overgrowth of yeast in there. And since high glucose is present in saliva, sweat, and urine, that can lead to yeast overgrowth in the mouth, the genitals, and other areas. So we know that poor glucose control leads to this, and it weakens the immune system as well. And that is through the mechanism of reducing the activity of T lymphocytes and neutrophils. The fungal infections that you might see for a patient with diabetes come in the form of Candida albicans. So you might see athlete's foot, jock itch, ringworm, vaginal yeast infections as well. When we move to the bacterial infections, people with diabetes are more likely to develop a bacterial infection, and that's because high blood glucose increases bacterial growth and virulence, because bacteria uses glucose as its carbon source, its food. So the more glucose, the more rapid that growth of bacteria happens. And as I mentioned before, diabetes can impair the immune system. And so that makes it harder for those white blood cells to fight the infection. And that's because of a decreased production of neuropeptides, damaged neutrophils, and a poor blood supply to the area, which is often due to the blood vessel damage that happens in diabetes as well. Bacterial infections can present in the form of styes, infections in the eyes, boils, folliculitis, infections in the hair follicles, carbuncles, which are deep infections of the skin and tissue underneath, and nail infections. But people with diabetes might be more tendent to be infected with unusual organisms, such as fungi or gram-negative bacteria. Dry skin is very common. And these are things that, being in diabetes for a couple of decades, we didn't know this back then. And people would present with this dry skin or these other skin issues, and we just didn't have the connection. Now we do. We know that glucose is osmotic, pulls fluid with it. And as when we treat DKA, we're treating the fluid and electrolyte imbalance, right? So the high blood glucose causes dehydration. And that reduced blood supply, because of the damaged blood vessels, can make it more difficult for the skin to be hydrated. There's nerve damage possibility, and that reduces sweating, which keeps the skin moist, and a compromised skin barrier as well. So what's the pathophysiology? High blood glucose stimulates direct cell damage and indirect impairment through advanced glycation end product, or AGEs. And those AGEs alter the skin structure and skin function, and they're also involved in the pathogenesis of vascular complications. High blood glucose also affects keratinocytes and fibroblast activities, and that changes the protein building and the proliferation and migration of protein as well. So these are some of the common skin conditions that occur in people with diabetes, and we're going to detail them more in the next module. So we'll just touch on them right now. Acanthosis nigricans, we've got blisters, diabetes dermopathy, diabetic foot ulcers are quite common, disseminated granuloma annulare, or rashes or rings in arcs, in rings or arcs, bumps on the body, lipohypertrophy, quite common in those that inject insulin, necrobiosis lipoidica, skin tags, and vitiligo. So again, we'll detail those more in the next module and what the treatments might be. Now we've got some medications that can cause skin conditions, some that are used to treat skin conditions, and I thought I'd walk through how they impact glycemic control and other determinants for this. So metformin and DPP-4 inhibitors have been noted to cause some skin reactions in some people, but they improve glycemic control. So we've got to balance that off. Oral and IV corticosteroids are used in a multitude of areas, from organ transplantation wood, and they are used for rashes and for asthma. So you have to pick your battle here as well. So the key messages here are that diabetes can cause several skin conditions, and they include the general groupings of fungal infections, bacterial infections, and dry skin. High blood sugar is the root cause for the alterations in the skin function. So we need to get that under control and help the patient understand that as well. And as these are really common, the skin conditions, we need to reassure the person with diabetes they're not alone. So I want to thank you. Oh, sorry, we'll edit that.